Hey everybody, welcome to the training. I'm really excited to do this one for you. I'm going to be answering a lot of questions that we get about the differences between therapy and mental health coaching. If you have either struggled with depression, anxiety, or another mental health problem for a long period of time, and you've been trying to question whether or not you should go to therapy or pursue a different route, this will be a very valuable video for you. Or if you feel like you've been using therapy for a long time and maybe you're not quite sure if you're getting the results out of it that you would like, this video will be helpful as well too. So the first thing I want to share about this particular concept is I love therapists and counselors and pretty much any mental health professional, quite honestly, out there. So this is not, I'm not interested in bashing anybody. I'm not interested in diminishing anybody who's trying to improve other people's mental health. Really, what I've come to realize is there are many ways to improve your mental health. There are certainly preferences that people have in terms of style and approach. And my big belief is that you've got to implement the mental health plan that's going to be best for you. However, what we have to do is make sure that you're implementing a plan for your mental health that doesn't cause you to get stuck, and make sure that you are actually going to reach the mental health outcomes that you really want. So what I'm going to cover in today's training is I want to help you understand really the criteria I think you should use to determine what type of mental health process or service you're going to use. And then I also want to just really make sure that I can clear up exactly what the differences are between traditional therapy or counseling and then what I do with our conditioning-based mental health coaching. So feel free to add in any questions in the comment section or write into us, and we're happy to address those. So firstly, let's go through the 8 big differences between traditional therapy or counseling and then mental health coaching, the way that I do it. So firstly, I want to say as well that I can't speak for other coaches out there. The coaching industry is a big, vast thing. There are other people through my research who put themselves out there as mental health coaches. I have never found another coach who uses the same process that we use or approaches it the same way that we do. And in my experience, I have not yet found anybody who tends to get as strong or reliable results as our method. They may be out there, but I have not yet discovered them. So all I can do is really speak to how I do mental health coaching and my method. So I'm not speaking for all mental health coaches here. So let's take a look at the first big difference. The first big difference is that therapy, traditional therapy, tends to look at repetitive emotional challenges as a permanent mental illness. Whereas what I look at with depression and anxiety and other mental health challenges is I see that they're obviously very real. I'm not, saying that people are making them up. I know that that's a common statement that people who've struggled with mental health challenges have had to combat their whole life when people go to them and say, oh, this is just, it's all in your head. Well, in a sense, yeah, it's all in our head, right? That's where depression and anxiety takes place, is our head. But what I know is that it's not like you're just trying to get attention. I know that you're not just making it up, right? You're not manipulating people through your problem. But what I look at with depression and anxiety is they're very real. However, they are very changeable. They're very changeable. They're very, very improvable. And really the way that I define them is they are conditioned patterns of emotion and thought in the nervous system. Keyword is conditioned patterns. And what this means is that because it's a conditioned pattern, it can be changed. Our nervous system is highly trainable, right? We can use systems and processes to get ourselves to think differently, to feel differently, to behave differently. And by learning how the nervous system works and learning the key strategies to actually embody those types of new changes, people can empower themselves with a set of skills so that they can think, feel, and behave the way that they want to the vast majority of the time. That's what I believe. And that's what I've found to be true for myself personally, and obviously through our clientele. This tends to be true. So the big belief that I have is that you can never solve a problem that you are defining in unsolvable terms. And this brings me to point number 2. Therapists predominantly look at a situation of depression or anxiety, and they mean well. They're doing what they're trained to do. But the way that their training operates is that when somebody comes into their office, typically the majority of the time, what they are looking at trying to do first is to provide a diagnosis. So when the person is telling them, oh, I'm really stressed out in my marriage and I'm feeling anxious and I'm feeling worried and I don't know if we're going to make it. And, I get a little anxious and worried at work too. Right. So if someone starts talking like that, the therapist is listening. And really what they're doing is they're taking in the information that the person is providing in the therapy session, and they're trying to match that with a criteria for diagnosis, okay, in the psychiatric manual. And the idea here is that well, first of all, this is how a lot of therapists are paid. Many therapists are not even paid unless they provide a diagnosis, because then they can't bill insurance very often. But the other idea here is once we provide a diagnosis, then that gives the patient or the client this, this feeling of it's not your fault. This is a part of your life. This is just who you are. This is a disease, essentially, right? Therapists may use different language. But the idea is, yeah, this is just a part of you. This is a part of your life. This is a part of who you are. We need to treat this and we need to improve this. But the challenge with that I find, the diversion that I have, again, not saying it's right or wrong, I just tend to find that that's not the most helpful way to go about it. The problem I find is that when people go down that route, once they get that diagnosis and it's pre-framed to them that way, what they do now is they mentally change the definition of their problem. They change the definition from, well, yeah, I'm feeling anxious and I'm dealing with this emotional challenge, I'm not sure what to do, into, oh, this is a thing that I have. This is kind of a part of who I am. And so what they do is they start to identify with that conditioned pattern of emotion, right? Whether it's depression or anxiety. So yes, the emotion of depression or anxiety is very, very real. The pattern, the conditioned pattern of thinking and feeling and behaving in a depressed or anxious way, very, very real. But the part where I diverge with how a therapist would approach a situation like this is a therapist looks at it as, yeah, you have anxiety, you have depression. And what the patient feels very often by that is what they're really thinking is, oh, this is something I've probably always had. And this is something I probably always will have, right? And that is kind of one of the paradigms of traditional psychiatric work, is this is a part of who you are. Different therapists will have different, ideas in terms of where that came from. Maybe they'll look more at genetics, maybe they'll look more at background, but really the idea here is, yeah, you have this illness, you have it, just like, you would have like COVID, you contract COVID, now COVID is in your system. That's kind of the idea. Okay, and you'll see here momentarily why I disagree with that quite a bit. I'll share a quick story to kind of explain one of the reasons why I'm not a big fan of this approach. So I had a client, she was a really nice lady, middle-aged, and she was dealing with a lot of panic and agoraphobic tendencies. So she was having difficulty driving, having some panic attack challenges, and she had been feeling this way for close to 30 years. I think it was about 25 years or so. She was in her 50s. And I asked her, how long has this been a problem and where did it all stem from and all of that? And come to find out that the first time she could ever remember feeling slightly anxious was early college years. And so I had her retrace her steps a little bit. And I said, okay, what happened during those college years? What was going on? And she said, well, I was feeling really stressed and it was my first year of college. I was having a tough time adjusting to the new environment. I was feeling a little worried and anxious. And I went in and, my parents set me up with an appointment with a psychiatrist. So I went in to see the psychiatrist. And in the very first session, I come to find out that the psychiatrist gave her the diagnosis of panic disorder. Okay, now, prior to that session with the therapist, she had never even uttered the word panic to describe her situation. The way she described it is, I was feeling a little stressed. I was feeling a little anxious. And she had been feeling that way for approximately 6 months or so, 3 to 6 months, if I remember correctly. Then she goes and sees the psychiatrist. Now, the psychiatrist, what means well, they want to help, right? But the way that they're trained to help is, let's take the information and let's match it up with diagnostic criteria in the psychiatric manual, which, by the way, I have seen in my experience, there is not any objective, clear-cut standards. Like, yes, there are things written in the manual that are supposed to be found, referred to. But I have found that when I do consultations with people, I'll have some people that are exhibiting symptom A, symptom B, and symptom C, and they were previously given a diagnosis of generalized anxiety disorder. And then I've seen some people who have those exact three identical symptoms, but with a different therapist, they were diagnosed with bipolar disorder. So it can be, it's not as clear cut as people think it is, right? Even just the diagnostic process. But anyway, that's beside the point. So this client of mine back in the day when she was in her college years, she sees the psychiatrist. The psychiatrist gives this diagnosis to her. Yeah, you have panic disorder. And she goes, oh my goodness, panic disorder. What is that? And the psychiatrist says, well, you may be prone to panic attacks. She had never had a panic attack before this, but the psychiatrist says, well, you may be prone to panic attacks. You may find it difficult functioning, doing regular things. A lot of people have challenges in public spaces, things of that nature. Now, mind you, this had not happened before the appointment. So she goes out of the appointment, and I asked her, I didn't lead her with this question. I just said, hey, I'm just curious, how did you feel after that appointment? She said, well, I felt a little better for about a week, I remember, because now I felt like I could understand my symptoms and I could wrap my head around it, which, by the way, this is why a lot of people are used to the diagnostic thing and they seek a diagnosis, because our mind has a huge desire for certainty and predictability. We like to put things in boxes and put labels on things, but our desire to put labels on things can sometimes be counterproductive, as the story will illustrate. So she said, yeah, I felt better for about a week or so. And I said, oh, okay, well, and then what started happening? She said, yeah, then I remember I got my first panic attack about 2 weeks later. I said, oh, that's very interesting. And I said, did they start becoming frequent, or, what happened? She said, yeah, they did. They started happening 2 or 3 times a week. And it was like that for several years. And it kind of leveled off, but now it's been at least twice a week for 20 plus years. And I said, that's really interesting. I said, if you had gone into that psychiatrist's office, right, and the psychiatrist had instead said to you, well, of course you're feeling stressed. Of course you're feeling anxious. This is your first year in college. You're away from home. You're several hours away from home, in fact. You're in a brand new environment. You're a young woman. You're surrounded, in surroundings that sometimes maybe you might feel unsafe in. Of course, you might be feeling a little anxious or stressed, but you're feeling really anxious or stressed because you're about to finish your first year of college, and things will probably, ease up for you in the summertime, right? And I asked her, what do you think truly, just give me the honest answer. What do you think would have happened if you would have left that office and that's what they would have told you, instead of telling you you've got this panic disorder thing? And she thought about it for a second. She said, you know what? I think I would have felt a ton better. And I think things would have probably actually gone back to normal, because I asked her, well, what was going on in that time? She said, yeah, it was my first year. I was about to do my final exams. I was worried. I was a little stressed. Yeah, that's how a lot of college people, feel. So what the psychiatrist did is they were trying to help, right? But the problem was, by giving her this diagnosis, what happens now is the client has this thing, this object, this idea of this diagnosis, and they have now changed the meaning of their situation. They have created a new definition of their problem. They're now defining their problem as, oh, I have panic disorder, right? And then what she starts doing is mentally going, oh, and I might be prone to panic attacks. So what that does is it causes her to mentally start to anticipate having the problem. And the mental anticipation of having the emotional problem is what creates the emotional problem very often. And this is part of what leads to serious depression staying with people for a long time, or serious anxiety, because people go, I've got clinical depression. And apparently my dad had depression too, even if it was undiagnosed. And this is just who I am. I am going to be depressed for the rest of my life to some extent. So people make this vision of the future now that they've gotten this diagnosis, because again, the paradigm that the psychiatric world is operating in is this is probably going to be with you for the rest of your life, but you've got to learn how to deal with it. And so now mentally what happens, and this has probably happened for many of you, is you start to mentally anticipate what your future will be. And one of the universal laws I have found is our mind does not know the difference between what we imagine and what is real, right? Especially if we vividly imagine it and we imagine it again and again and again. So when we anticipate, oh my gosh, I could be prone to panic attacks, that means tomorrow I might have a panic attack. That will start the sensation of panic. When you go, oh, I'm going to feel depressed for the rest of my life, that thought creates the constant feeling of depression. So what I have found is a far more superior way of helping people get their mental health where it needs to go is to call it as it is, but not call it as worse than it is. Yes, you are dealing with a conditioned pattern of the mind. Yes, your mind is not operating the way that you want it to. However, you can learn to train it to do what you want it to do. Okay, so that was a long explanation on this second point, but I think it's really important because I know a lot of you guys have been in this position where you've simply adopted the psychiatric paradigm, which, by the way, for those of you who don't know the word paradigm, paradigm just means a commonly set held idea of beliefs and assumptions. And so in the psychiatric world, one of those assumptions is you're going to have this for the rest of your life. Another assumption, as we'll get to in a minute, is this is going to take a long time to handle, right? And so when we adopt that idea, when we adopt the idea of, I can't really solve this, this is going to take a long time, and I'm going to keep feeling like this for a long time, we start to feel worse. Okay. And that becomes a big challenge. Okay. So let me just recap real quick. Number one, therapists look at emotional challenges as permanent mental illnesses, whereas I look at them as a conditioned and changeable pattern of response in the nervous system. Two, therapists predominantly look at a situation as a copable problem, but not a solvable problem. So they prioritize coping mechanisms, right? The idea is to help you get through your life, get through your day in spite of feeling this way. So the assumption is you're going to feel like this, but let's give you some coping mechanisms to make it more bearable, make it a little easier, make it, more maintainable. I look at the problems as, in most cases, removable or at a minimum, highly reducible. So the typical pathway for me with a client is I typically get them on average about a 75% reduction in feelings of anxiety or depression inside of 90 days. Sometimes it can happen faster. For some, it takes a little more time, but that's about the average period of time that takes. Very often you can get rid of repetitive mental and emotional patterns. A common one would be, like OCD type tendencies where you're compulsively like checking on things 3, 4, 5 times, right? I have found that those can be gotten rid of. I've worked with people on addiction and alcoholism where they've stayed sober, right? You can get rid of a lot of those core things. Speaking to the idea of depression and anxiety, sadness is always going to be a part of the human experience for all of us from time to time. We will feel sadness every so often. But depression, the idea of the cyclical, repetitive, ongoing sadness of daily life, that I have found we can definitely remove. The second thing, I want to speak to anxiety for a second. Anxiety or a fear response is going to be a part of our lives to some degree, but it doesn't have to be, again, on a cycle. So the example I like to use is if a car almost hits you when you're walking across the street, you're supposed to feel anxious. That's a normal, healthy response. Right? But you shouldn't feel anxious just going to work or driving on the road or going to a movie theater or worrying about other people's opinions of you all the time. That persistent cycle can be removed. So I just want to be careful with my language there. Okay. Number 3, many therapists believe that the problem is biochemical, and also the solution is biochemical. So not always, but a good chunk, I don't know a percentage, but a big, very large chunk of therapists and even counselors will tend to try to push people towards medication. Now, again, they're doing what they've learned. I'm not blaming them. And sometimes it helps. Sometimes people do need to be on medication, and that is the right route that they need to go down, and that's what they need to do. So I'm not, again, not diminishing them, but I have a different point of view on this. I don't see the source of depression and anxiety as biochemical. What I see it is the biochemistry is the effect. Okay, let me give you a simple example. Right now, here's what I'd like you to do. I want you to think about your favorite food. Just think about your favorite food and what it would taste like if you were eating your favorite food. Okay. Or a food that you really like. Don't get hung up on the favorite thing. Like a food you really, really like, and think about eating that food right now. Okay. Now, do you notice that maybe you feel a little salivation in your mouth? Do you feel maybe a sense of hunger or a sense of desire kind of wells up in you a little bit? Okay. Well, what has happened just now is we have fired off a particular biochemistry in your nervous system. Okay. Now, I'm not going to take all the time to do this in this particular video, but another example would be if I have you, let me do you just one more example. I want you to imagine now something that you are afraid is going to happen in the future, like a fear or a worry or something that you're worried is going to take place in the future. Just think about that, even if it's a mild one, like, you're afraid you're going to get an argument with your spouse up soon. Okay. Just think about something you're afraid of. Okay. Now, if you think about that, you'll notice again, there's a change in how you feel. Do you notice? Right? It might be subtle, right? Because I'm not taking a lot of time to have you really fixate on it. But what happens is you think about a particular thing. And as you think about that particular thing, there is a biochemical effect to the thought. The biochemical effect is essentially the emotional sensation. So here's the problem I run into a lot of times. I consult with probably close to about 1,000 people a year. I don't have 1,000 clients a year, but I do about 1,000 consultations a year. And what I found is that very often people will be highly medicated, but they'll still be depressed. They'll still be anxious. Well, how in the world could that be? Because they're introducing a pill that is meant to change the biochemistry of anxiety or of depression. So how in the world could they still be anxious or depressed? Well, part of the problem is, yes, I can take a Xanax and that might diminish the feelings of anxiety. However, if throughout the whole day, my mind is still habitually thinking about, oh, what if this happens? And what if that happens? And what if this, that, right? The mind has about 100,000 thoughts a day, and each day they're about 80 to 90% the same. So if I can take a Xanax and that might temporarily make me feel a little better. But if my mind is still going through all those intrusive things, it's like every one of those intrusive thoughts is like a tiny anxiety inducing pill. So me taking an anxiety reduction pill, it's like fighting against the current, right? Like it's not going to solve the real problem. The real problem is that there is a conditioned pattern of thinking that is going on a repetitive basis. So yeah, we can mask the issue. We can bring in a pill that's going to change your biochemistry. And by the way, some people, like, this is all they want. Like, I'm not bashing medication. Like, some medication is very good for many, many people, right? And I'm also, just to be clear, I cannot give medical or legal advice. So if your doctor has told you you need to take this medication, I am legally obligated to tell you, continue to take that medication, right? And even if for my clients who want to sustainably get off medication, the majority of them, I tell them the same thing. If you do want to eventually get off medication, you need to do it carefully. You need to make sure you are speaking to your physician, because once you get yourself on it, it takes a while to safely wean yourself off. But anyway, beside the point, we can't just medicate it and then expect the anxiety to go away in most cases. Sometimes that works, but in most cases, that is not the case. Because anxiety, guys, is not just a biochemical, it's not a biochemical imbalance. It's not random. Anxiety is not random, and it's not determined by your genetics. Genetics play a role, but it's not determined by your genetics. In the vast majority of cases, like 90% plus, okay? Whenever I am working with a client and they're dealing with anxiety or depression, what I come to find out is that they have serious expectations of their life that are not being met. And that is a huge part of what creates the sensation of depression or anxiety. If someone is feeling depressed, they usually either regret that something occurred from their past, they have zero hope that something is going to take place in their future, or they are consistently recycling the pain of the present and they're overly focused on the pain of the present. Well, popping a pill does not solve any of those problems, right? Very often people are depressed because they had a vision of where they wanted their life to be, and their life has not turned out that way. Popping a pill does not solve that problem. Popping a pill does not help somebody process their grief better. Popping a pill does not help somebody have a new, better version of the future, right? In the vast majority of cases, there's a very small number of people where they can pop a pill, feel better, and then go, oh my gosh, I feel so good. Now I feel good about the future. That does happen for some people, but not most. Same thing with anxiety. When people have an anxiety issue, right, almost always there is, again, a disconnect between how they expect life to be and how life is. Some common examples would be people tend to have perfectionist tendencies. So they are overly critical of themselves, and they constantly are scanning, looking for problems, looking for imperfections in themselves. That's a common source of anxiety. Well, popping a pill is not going to help that person's self-esteem, right? Anyway, sorry, I get very passionate about this because I just see people who get stuck going down those routes, and it bothers me. Okay. Anyway, so that's the third one, is therapists believe that the issue and the solution very often is biochemical. And I see the effect I see that there is a biochemical effect, but the source or the cause is not biochemistry. Okay. Number 4, therapists tend to be more passive and non-directional without a very clear plan of how to get the person to recovery. Okay. So what I mean by this is, again, because the paradigm is you're going to be dealing with this, you're probably going to be dealing with this for a long time, their plan is usually just, yeah, you need to come to therapy. You need to keep staying and coming to therapy, and it's going to take a while. And they don't exactly have like a checklist in mind in most cases of like, yep, we need to solve this problem, and then we need to solve this, and then we need to do this, right? It's more like they're taking it sort of session by session in most cases. And they're just looking for the ongoing continual exposure of therapy to kind of work over time. That's an approach, right? The challenge with that is a lot of patients or clients tend to feel directionless with therapy and counseling. Like they feel like they end a lot of sessions without a lot of clarity. Sometimes they've got more questions, or they feel worse at the end of a session. And that can be a problem. Now, there are a small fraction of therapists that have very clear structured plans. It's a very, very small number of them who really have a like A to Z step series of plans that they're going to use. It's usually not the case. Okay, with me, what I do is I have a 12-week process, right? And I am like, oh, first we need to deal with this, then we need to deal with this. Okay, great, we got those handled. Now we need to deal with this. So I start with helping people learn how to train their brain moment by moment. So I teach people the 3 key things that trigger emotional states, and I show them how to start using that. I show them how to start reducing feelings of anxiety or depression by about 10 to 25% in the first 2 weeks. Then what we start to do is we start to tackle internal subconscious beliefs, and we start looking at what we call your model of the world. And so we go deeper and deeper and deeper. And then towards the very end, we talk about sustainability. How do you make sure that now you've gotten all these results? What's your daily system for sustainability? How do you maintain it? What do you do if you run into a problem, right? So it's a very clear boom, 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 boom structure, right? And so when I'm working with client, I'm always taking them through that plan and structure. It's just a different way of going about it, okay? I'm not saying either one is better or worse. It's that either one is better or worse depending on who you are and what your specific goals are, okay? Number 5. In the first couple of sessions, so there's a big difference between how therapists approach the first couple of sessions compared to me. The first couple of sessions, a therapist typically is looking to gather information, a lot of information. They'll tend to focus a lot more on the past. And again, the idea is, yep, buckle in. We're going to be here for a while. Let's take a look at your past and let's see what's going on. And a lot of therapists will spend a lot of time focusing on the past, which is the difference number 6, okay? But anyway, let me stick to number 5. So what I do with my first couple of sessions, well, I pretty much just described it. So I start with immediately, here are the 3 skills you need to start improving your emotional state, start practicing them. Then I have my client practice for about 10 days. Then I check in on their practice. Then I give them another skill. Then I have them practice a little more. So we are constantly looking to shift the needle, right? And that's what I'm a big believer in, is what is the next piece of instruction that the client needs in order to make a little iterative more progress. That's what I really believe in, okay? Number 6, I kind of just started this one. Most therapists will spend a large portion of session time focused on the past repeatedly. Now, I want to add the word repeatedly there for an important difference, because the past is not to be ignored. I'm not saying, hey, never talk about the past. Sometimes you do need to talk about the past. However, we need to spend about 5% of our time looking at the past so that we can figure out, okay, well, how did you get here and what's going on and yada, yada. And that can be very important. And in many cases, by the way, it's unnecessary. Like, I've had clients before where we can never really figure out where the anxiety came from. It seems like it just came up randomly. And so therefore, our focus just needs to be, cool, how do we get rid of it, right? Because that's all that really matters. So I spend the majority of my time focusing on the future, right? How do we create the future that you really want, as opposed to how did you get here from the past? That can be interesting, but you don't need to do it. And you certainly don't need to do it repeatedly on an ongoing basis. Like, oh yeah, let's talk more about your problems with your dad from 30 years ago, right? When you focus more and more on the problems of the past, you bring the energy of them into the present. So the pain of the past relives itself again in the present. And that can be a big problem, okay? Number 7, most therapists will provide a couple coping strategies, and then they'll revert to just passive talk therapy. So a lot of therapists will have a couple strategies in their back pocket. The most common ones I find that are referred are journaling is a big one. Another big one would be breathing exercises. Right now, the common one is box breathing that's recommended. Another common one is they'll recommend more physical exercise, and then meditation, right? Those are kind of the 4 big ones that most therapists will recommend. If somebody is a CBT therapist, they will usually have maybe 2 or 3 CBT little strategies that they'll teach. If they're a DBT person, they'll talk a little bit more about, okay, well, let the thought come and let it pass and don't do anything with it. But once they've shared those handful, maybe half a dozen strategies, the majority of therapists then just kind of go back to, okay, great, well, let's have you talk and let me give this space for you to process your feelings. And I'm not really going to direct you towards a solution so much. I'm more so just going to create a space for you to more so direct yourself a little bit more so. So most therapists are not, going much more aggressively after the issue. They'll apply those couple of strategies and then go back to the talk therapy idea. And by the way, I should hit on this. The reason why this whole idea of like long-term talk therapy is still the paradigm, this goes like all the way back to the late 1800s when Sigmund Freud was around. And so what he developed was what he called the talking cure. And the idea behind this was put the patient on the couch and let them talk, and just let them talk and talk and talk and listen and take down notes and kind of reflect what they're saying back to you like a mirror. Like the therapist is supposed to be a mirror for the client's thoughts. That's an analogy that is still taught today to a lot of therapists. And so the idea is you're not giving direction to the client. You're just letting the client process. And by the client processing and getting things out in the air, therapy happens, right? The pain is relieved and healing takes place, which, by the way, does happen. It does happen for some people in some situations. So for some people, therapy is like the right thing for them to do, because all they really need is that cathartic release and to get things out. And that can be a very therapeutic thing, as opposed to bottling it up and repressing it. This is why I very often will tell people that going to therapy is probably better than doing nothing in the majority of cases. But therapy is very often not sufficient for people who want to live, a normal, happy, healthy life where anxiety and depression are not ongoing problems. Okay, so that's a big difference. Now, for me, as opposed to sticking to 5 or 6 strategies and then kind of running out of strategies, I have over 100, yes, over 100 different strategies that I use. Now, of course, I have preferences because there are ones that I find that work really well for a lot of people. But what I have come to believe is that I cannot be allegiant to any one particular school of thought, because if I'm allegiant to one school of thought, I'm only going to be able to help the people that school of thought helps. And I'm not an advocate for that. My whole mission is to make sure that there exists a set of tools and there is a process by which anyone on the planet can have the mental health that they desire. So everything I do is about, okay, great, guys, here's what I think is going to work for you, because this is what I see tends to work for clients like you. Try this out. Let's see what happens. Oh, that did work. Okay, great. Let's keep doing what works and let's do even more of that. And let's try this little tweak over here. That's working. Okay, cool. So it's this constant iterative process where I'm pulling lots of stuff from my bag of tricks to figure out what really works. Now that I've done this many times, I'm able to kind of shortcut the path, because I know, like, here's what you got to do to get anxiety handled. Here's what you got to do. Like, I know it now, right? And now that I've dealt with like health anxiety and agoraphobia and all these things, I know what's going to happen. But there are different types of nervous systems. There are really three big types of nervous systems. Not going to get into that right now. So we have to do a little trial and error to make sure we find something that works for the client. And we can't just stick to the same basic things and then kind of like put our hands up and go, well, I don't know what else to do, but let's keep talking about it, right? Which is not the way to go. Okay. Number eighth and final difference between traditional therapy or counseling and me is that most therapists think that the way to create sustainable success is to remain in therapy. This is a big belief. The idea is, yep, you should probably plan on being in therapy maybe for the rest of your life, right? And that's what they believe is kind of your best way to sustain your success. I do it differently. I'm not saying that's wrong. I'm sure that's great for many people. I have encountered some people where so long as they just do the therapy weekly and they get everything off their chest, they feel great. That's cool. Do that. I do things a little different. What I do is I want to make sure my clients are able to be independent long-term, because that's what I believe you guys are really after. I don't think you're interested in like keeping a coach or keeping a therapist long-term unless you absolutely have to do that. I think ideally what you'd really like to do is go live your life, live it normally, live it joyfully, live it happily, and have a system in place where you can know for sure that you can stay on the right track and know that even if you run into a problem, you can revert back to tools that you know. And so that way you can pull yourself out of it and have the pride of knowing that you've done that. That's what I believe. So that's what I teach people how to do. When people get to the end of my process, I give them a simple daily mental conditioning process that they use on a regular basis. And then the big thing that we do is we have a relapse prevention process that we use as well. And that's really important. So that way, my clients very often, they work with me for 3 months, and most times, probably 3/4 of the time, they get rid of me. If they don't get rid of me, we're usually not talking about mental health stuff after 3 months. We're then talking about how to grow their business or how to improve their relationships, things like that. So that's how we do it. Okay, now I want to close by talking about how I think you should make your mental health plans and decisions. Okay, so first of all, I am legally obligated to tell you if you feel that you're dealing with anxiety or depression, I'm legally obligated to tell you, you should see a physician, you should see a psychiatrist or whatever, and you should get their opinion. Okay. However, what I want you to keep in mind is there are a couple of rules of thumb I've found to be pretty helpful over the years. Firstly, there's nothing wrong with going through therapy. Try it out. If that's what you want to do, go for it. If that's what if you think you really just would benefit by having someone listen to you and not judge you and let you talk things out, and because that's going to be about 70% of it, then go do that. You really should give that a shot. However, you've got to get clear on the outcome you're after. This is what is important. Most people are going through therapy, medication, or they don't know what to do because they don't even know what they want for themselves mental health wise. My hallucination is that what you probably want is you probably want to, if at all possible, live free of the cycle of anxiety or depression, right? Where your mind is not habitually going through those constant anxiety inducing or depression inducing thoughts. That's what I believe. That's what I hallucinate is probably your goal. Okay. If that is your goal, it's important to know that the majority of therapists are not even going to believe that that's very possible. Or they're going to probably say, well, maybe it's possible, but you need to probably be on medication so that we can see what happens. So therapists are great people, but therapy is only the right fit for a certain type of person long term, which is somebody who is going to benefit from that particular set of assumptions and set of strategies and process. Okay. So The rule of thumb I found to be pretty helpful with therapy is usually the 6-month rule. I'm not saying like if you go through therapy and you've done it for 6 months, you should have the whole thing solved, because that's not even what a therapist believes. But what I'm saying is, if you've gone to therapy at least twice a month for 6 months, and you feel like you are continuously getting better, that may be a sign you should stick with it. That's probably a sign you should stick with it. If you have been going for 6 months and you feel like you have either hit a plateau or you've not gotten up off the ground, in my experience, people who continue to stay in therapy who feel that way tend to not get any farther. Or I should say not get much farther. Okay. Again, everyone's a little individual. I'm probably going to get some comments on here about your guys' experience, and I'd love to see them, because I know some of you guys have good experience with therapy, some of you not so good. Okay. So I'm not trying to paint with an overly broad brush. I am, however, trying to just give you the honest truth of like the thousands and thousands of people I've talked to over the years, and like the constant stream of information I'm getting about what kind of effects the therapy has for them, what kind of problems they're dealing with, how effective therapy is at dealing with that set of problems, all that type of stuff, right? That's just something you need to be keeping in mind. So number one, get very clear on your outcome. If your outcome is, I want coping mechanisms, I believe this is going to be with me for the rest of my life, I'm fine coping and dealing with this and just talking on a regular basis. Boom, that's great. If that's the outcome you're after, therapy is probably the right thing for you. If the outcome you're after is, I don't want to be dealing with a coach or a therapist for the rest of my life, I want to live my life, I want to get rid of this damn thing, I want to rip the Band-Aid off. Okay, well, therapy is probably not the right route for you long-term, because that's just not what they teach you how to do. Okay, so that's a big thing you need to understand. A second thing you want to get clear on to make the right decision for you is, how do you want this journey to go? Do you want to ease your way into it? And do you want to take your time with it? And you're comfortable taking a long period of time? If that's the case, therapy is probably the right way for you to go. If you want to get this thing handled as quickly as possible, the route, kind of a route that I take, is probably the better route for you to go. On that same point, do you want someone who's going to be like constantly just like validating and supporting, and they're not going to challenge you to think all that differently? They're more, I don't want that to sound unfair, because therapists do challenge people to think differently, but that's not their usual primary intent. Their primary intent is usually, okay, let's give you a place to process your feelings and validate your feelings. I'm a believer that validation is good, but validation can become a problem when we validate people for staying stuck, or for staying, like continuously reciting a story of limitation in their head. I'm not for validating that. So what I believe with my clients is that, yeah, you need to get out of your comfort zone. We do need to challenge you a little bit. You need to build some muscle. Getting emotionally fit is the task at hand, so that way you can go into the world and you can handle what comes to you. Just like getting physically fit equips you to deal with physical challenges in the real world, I want my clients ridiculously emotionally fit. To do that, we have to slowly, iteratively get the comfort zone expanded. And so I have to have a level of honesty with my clients. I have to be willing to call them out on things from time to time. Of course, I honor them and I respect them and I want what's best for them. In fact, I want what's best for them so much so that I am willing to say what needs to be said, as opposed to biting my tongue and making sure that they feel safe and comfortable, even if them staying safe and comfortable is going to keep them in pain. If I know that I've got to disrupt that current story of limitation, or I've got to help them, then I will point it out, because I care about them that much. I am willing to do what is necessary to make sure that they get what they need. But that mentality that I'm describing that I have is not everybody's cup of tea, and I'm self-aware enough to know that that's the case. Okay, so these are kind of the big differences between therapy and coaching. Get clear on the outcome you really want. Get clear on the way you want to accomplish that outcome. And then what you need to do is go find the help that you feel is best for you. And by the way, my team and I are happy to help you get access to a therapist. I know a lot of people have trouble finding therapists. I am not trying to prevent anybody to go to therapy, particularly if you find it helpful. If you do, please continue to do it. Sometimes we can find something to be helpful, but it's not sufficient, right? So some of you guys have been going through therapy and medications and it helps you, but it's not been enough to get you to that ultimate mental health goal. That doesn't mean stop the medication or stop the therapy. It just means you need to equip yourself with the additional set of skills and systems you need to get you where you want to go. Okay. So do what is right for you, but do something. You got to take action, because no one is going to come and do your healing for you. No one is going to come and hand you great mental health, right? You've got to step out. You got to reach out. You got to grab it. You got to do something about it. Okay. So I hope you found this training helpful. Please let me know any questions you have. We're happy to help you. And if you do need any help getting in touch with a therapist, or if you have questions about becoming a mental health coaching client, just let us know in the comments. Or write into us, or you can always go to mentalhealthcoaching.com to get in touch with us. And we want to support you. We want to help you. Okay. So thank you for your attention. I hope this has been useful. Congratulations for taking action to improve your mental health, and we'll chat with you soon. See you guys.